For most of the year 2022, COVID-19 was on the decline. Vaccination increased across the world, and there was sustained progress in many low and middle-income countries that were left far behind in 2021. Some countries relaxed their COVID-19 protocols, including Nigeria. Just when the world thought they were seeing the end of COVID-19, there came an upsurge in China. There are concerns about China's sincerity with the data of the upsurge of COVID-19 in the country. This led to most countries putting in place new testing restrictions for Chinese travelers, a move Chinese health authority rejected, saying it has no scientific basis. The World Health Organization stresses that data remains essential for the organization to carry out regular, rapid and robust risk assessments of the current situation of COVID-19, calling on China to share the data on COVID-19 and also conduct studies on how to prevent future pandemics. Global Health Digest this week focuses on the COVID-19 outbreak in China and what countries, especially Nigeria, should be doing in response. I am Uche Ugochukwu. Welcome. Let's watch this background report before we continue.
Three years after the first outbreak of COVID-19, China is struggling to contain a coronavirus resurgence. Experts fear that the situation may worsen in the coming weeks, even as the authorities are being accused of undercounting the fatalities. China has to choose between continuing with the easing of restrictions or reimposing long lockdowns that have battered its economy. Worldwide experience shows that lockdowns merely delay the inevitable. The focus should be on living with the virus rather than trying desperately to shut it out. The COVID-19 upsurge in China has been a matter of public health concern in Nigeria, following measures taken by other countries to check import of the variant of the virus from Asian countries. The NCDC-led COVID-19 Emergency Operations Center, EOC, is monitoring COVID-19 trends in China, the United States of America, the United Kingdom, South Africa, India, and other countries with a high volume of traffic to and from Nigeria. The results showed that with the current vaccination program and 50% of the population wearing masks, mainland China can be protected at low resurgence risk. The findings revealed that the integrated effects of multiple factors such as waning immunity, antibody-dependent enhancement ADE, relaxed interventions, and higher variant transmissibility make controlling COVID-19 challenging. We should prepare for a long struggle with COVID-19 and not entirely rely on the COVID-19 vaccine.
I've heard about the resurgence of COVID-19 in China.
I have fair knowledge on the resurgence. I know I've heard it once or twice, but it's not as serious as way back in 2020 where it was everywhere. Like now I would have been putting on a nose mask and, possibly there will be lockdown on some areas and everything.
Actually, I'm just hearing it, this second one for just the first time. So I've not actually started taking any precaution as in for now. I thought maybe it has gone and it's gone.
This time we have to get everything ready. Like the government have to do their responsibility and to stop that before coming in to the country.
What we'll do, we'll make sure we maintain those measures we're asked to put in place in our offices and in our residential buildings.
Have you taken a COVID-19 vaccine?
Not yet.
Why?
Okay, that because I've been so busy.
Welcome back. It was really fun but great listening to the feelings of people on the streets about the resurgence of COVID-19 in China. We also spoke with experts on what Nigerians need to know and how to guard against contracting any flu-like virus.
Let's look at it on a philosophical level in terms of issues of virology. Once there is a pandemic and the world is able to bring it down through vaccination and what we call herd immunity, if that virus keeps circulating in any part of the world and subvariants and variants come, there is a chance that the whole world can be infected again with a different variant. So what is happening in China is a little worrisome, even though for now what we hear and what has been isolated is a subvariant of the Omicron, which all of us know that the vaccines that have been developed and deployed currently around the world have been able to slow down the spread and almost eventually breaking it down to a very low or even disappearing. But so what's happening in China, like I say, is worrisome. You know, a lot of people have died in China. What I don't know how much they have vaccinated at a point. We thought they were doing a lot of vaccination. And also whether the vaccines they are using are also effective. Because I know at some point they refused to take the vaccines from other parts of the world. They are using their own vaccines. So my worry is that if it keeps circulating, the virus will eventually mutate to a more lethal one. And if that happens, and there's intercontinental travel between China and other parts of the world, and then of course Nigeria, then there's a possibility of Nigeria also being exposed. Mindful of the fact that we did not attain herd immunity in Nigeria, we haven't gotten to the level where we would say that the majority of Nigerians have been vaccinated and will have what we call herd immunity. Herd immunity is when you have about 70 to 80% of the population vaccinated. So it kind of gives protection of that particular variant of the virus, protection against it. Well, if you look at, first of all, you have to look at the genome of the virus. Is it a variant that has gone completely away from what we know? And then has it been confirmed that it's lethal? And when I mean lethal, that is killing people. And then another one, is it also confirmed that the vaccine that is already available is not protecting people? If all that have been confirmed, then China has no reason to reject what they are saying. WHO has the overarching responsibility to do this and advise countries. If WHO has come out to say countries should protect themselves by doing, I'm sure most countries will do that, but WHO stands for everybody, but most people will want to take their lives in their own hands, and they don't want to take chances. Because if you see what happened the last time, COVID created a lot of havoc, not just people dying. There was a lot of morbidities, and then of course the economies of countries tanked. So that a lot of people are afraid of that. They don't want a resurgence of what has happened. So it might be that people are overreacting, but people will say it's much more better to should I say, err in the side of caution than not doing anything. You know, recently South Korea banned flights from China. China retaliated recently, banning flights from South Korea. So I think scientific evidence should actually drive whatever we're doing. And I think that the people are a little feverish about what is going on, remembering that COVID-19, the first outbreak was in Wuhan. And then, of course, China at that time was in a lot of self-denial. And they didn't open up space for other countries, epidemiologists and virologists to really know what is going on. And because that didn't happen, a lot of people paid dearly for it. Let's say, for example, a country like America lost more than 1 million people during that the height of COVID-19, and see the number of people that died in Europe. Africa was not spared those colossal number of deaths, and I always keep saying our youthful population also helped us, but we don't know how far and how long that could continue to happen. So for me, it's the scientists in their country should do their own analysis and act based on their own best interest. I think they should also be guided by scientific evidence. And I feel this is the time WHO should take a lead and make sure that they advise countries appropriately. Remember too what happened when the Omicron came out. A lot of countries banned African countries from coming to their country because the first outbreak of Omicron was in South Africa. And there was a lot of diplomatic hula balulu. So why should they do that? Some people even said it was like a discrimination, a racist kind of thing. And it was WHO that came out and said that those countries should not have banned African countries. So I feel there's a responsibility that has been given to WHO, overarching responsibility to keep monitoring and use scientific evidence to advise countries. Even though I always say too, every country must act based on her own best interest and look at what they should do. For us in Nigeria, I keep saying that we must continue to monitor. If there's any time we can test, we can pull people and test, not everybody, but, do sporadic tests, and you can pick up if there's evidence that something is going on. You can have an inkling, and then that will help you act much more appropriately to protect your population. Yes, for that, I keep saying that somebody's health is a personal responsibility. You don't have to depend on government. The government, yes, have to do her own. But I've always said, regardless of even if it is COVID-19, if you look at 70, let me give you just a simple example. 70 to 78% of diarrheal diseases can be prevented if people can just increase their personal hygiene, wash their hands properly with soap and water before they eat anything. So it's been shown too for COVID-19 related issues. If you wash your hands, keep a distance, avoid large crowds. If you must be there, wear a mask. Until this thing is completely taken care of, you might be exposing yourself, especially if you're not vaccinated. And that's where vaccination is very important. So anybody that is not vaccinated, don't think it's over, especially with what is happening in China. I think this is the time to go get your vaccination if you haven't done that. The chances of succumbing to it or even getting ill enough to go to hospital is very, very low. It's been proven so well that vaccination helps. So that's my advice. Increase personal hygiene, obey all the non-pharmaceutical protocol indications, self-distancing, wear a mask. If you can't wash your hands, sanitize your hands before you eat. This is one area that somebody like him kept on saying that we as a people, especially government, should do a lot of public education and community engagement, because there were a lot of conspiracy theories regarding the vaccination. So with scientific evidence, we should continue to spread that information that the vaccines are safe. I remember when the vaccine came out, I was one of the first set of people that took the vaccination because I did a lot of extensive research on the literature behind the development of the vaccine and was convinced that everything possible was done to make sure the vaccines were safe for humans. So it's important to explain to people. One of the key things that made people believe that the vaccine is not necessary, that 5 to 15% of people who will still get the disease even though they're vaccinated, made a lot of people, even physicians and nurses, said, if I vaccinate, I still get the disease, so why should I go vaccinated? One of the key things they didn't realize that, yes, you might get the disease, but the chances of dying from it was quite remote. In fact, the chances of being hospitalized was almost next to nothing. So it's important to vaccinate. The myths and misconceptions, like I said, actually arose from the fact it's not 100% preventive purposes. But there are two levels of prevention. The first level, to get the disease. The second and most important one is to die from the disease. From the first one, you're not 100% prevented from getting it. The second one is almost absolute that you might not die from the disease unless you have very, very severe comorbidities. So my advice, please Nigerians, go get your vaccination.
With the continued circulation of the virus in China and the lack of a comprehensive data, it is understandable that some countries are taking steps they believe will protect their own citizens. Experts are concerned about the risk to life in China and reiterated the importance of vaccination, including booster doses, to protect against hospitalization, severe disease and death. And to know how other countries are responding to COVID-19, we spoke with Professor Walter Jalko via Zoom from Kenya. Professor Jalko is the director, Calvi Institute of Clinical Research in the Department of Medical Microbiology, University of Nairobi.
Yeah, it's a bit strange that the Chinese authority would be resistant in that regard. If you remember well, when the COVID pandemic started, there were just a few cases in China, and it sounded a very distant place when they would be reporting this new infection that people did not know the details about. But lo and behold, it didn't take long before the infection spread all over the world. So it's a bit strange for a government that is very familiar with the spread of infectious diseases to be reluctant to have people coming from their country tested, because that is the only way we can be sure that the people who are getting into our respective countries from China are not infected, and therefore the only way of curbing any new infections in our respective countries. So I would urge the Chinese authorities to not play politics out of this, but to be very pragmatic, because this is the only way we can be able to control the spread of the infection again. Yeah, I think the world has to realize that sharing of data does not demean a country in any way. And in this global world where infections spreads very rapidly to other parts of the world, it is necessary, absolutely necessary, that each country takes their responsibility and share whatever information they have promptly and accurately. The South African government was very quick to share with the rest of the world that this is something new we are observing, and people need to be precautious, to take some precautions against it. And lo and behold, within a very short time, the world was able to put its control measures in place. There is no shame in sharing data. And the days of being viewed negatively in the political sense, that you have an infectious disease when the rest of the world seems to be controlling it well, are long gone if we are going to work together as a global community to control the spread of an infectious disease. WHO is really urging China to be open about their data, their new infection that they're seeing. And if there is any new strain that they're seeing, they should be able to share with the world so that the world prepares in curbing such a new strain. I foresee that, especially if there is a reluctance in countries to screen people coming from these parts of the world, it is not rocket science that we will start seeing new infection. The way to deal with this, with increased travel from China and from other countries, within a short time, the virus would have gone to other countries if they are not screening for it. So the urge for the rest of the world is to be vigilant. One is to be able to screen people coming from the areas where the infection is spreading, like in China, and to be able to be very, very prepared for an eventuality of new infection. And it is in this regard also that we are encouraging countries that have a very low vaccination rate. And you know that Africa to date has the lowest COVID vaccination rates, that countries should not relax and instead should continue with the push to have most of their people vaccinated. because there is evidence that the vaccine that we are currently using are still effective against the new strains that have emerged so far. So if countries increase their vaccination rate and are vigilant with the new people coming into the country by ensuring that you screen them if they're coming from an area where the infection is high, like in China, then countries can be more confident that the infections are not going to spread in their own country. And if they come there, that they will be dealt with expeditiously. I think the world needs to realize that the world opened up from the close down that we had during the height of the COVID pandemic because of the vaccination. If you recall, places of worship, churches and mosques were closed down. Places of entertainment, cinema halls, stadiums were closed at the height of the COVID pandemic. It only opened up because of vaccination. The vaccines against COVID-19 are highly efficacious and have been able to contribute to the opening up of the global economy once again. The unfortunate thing about the vaccine hesitancy is that the rumors against COVID vaccination are largely manufactured in the West, where the vaccination against COVID-19 is highest. But the consumers of these rumors are largely in developing countries, and in particularly in Africa, where vaccination rates continue to be very low. If the rumors that are spread against COVID-19 vaccination were real, the West would not be vaccinating as highly as they are vaccinating at the moment. So I feel ashamed for Africa that we are the consumers of the rumors and falsehood against the COVID-19 vaccination, and our people have become very reluctant to receive the vaccine. Should we have a pandemic that spreads rapidly, if we get a new strain of a COVID-19 virus that spreads rapidly, that has high mortality, Africa will be the worst hit by the new strain of the COVID-19 virus. So my urge for people who have not been vaccinated and countries that have very low vaccination rates is to work on it, to improve the vaccination rate. And for anybody who has not been vaccinated yet, not to put themselves at an unnecessary risk of getting a severe COVID disease should such a strain arise. With the presence of an effective COVID vaccine and various different types of COVID vaccines that are all highly efficacious, I would urge those who have not been vaccinated to get the vaccine.
Professor Jalko has said it all. COVID-19 vaccination remains the best way to stay safe from the virus, and the vaccines are efficacious and safe. Please get vaccinated today if you have not received your jab. Yours truly has received her jab. Remember, your health is your responsibility. I am Uche Ugochukwu. I leave you with these tidbits.